Hello.
Good evening, everyone.
Good.
Side Dr. Vinod Kaushik with Dr. Alopi from IIP India Technical Team. I just welcome all the delegates and speaker and our moderator of this event for the webinar on the behalf of IIP India Technical Team. Here the topic of the today webinar is physiotherapy practice during COVID. That is a really good topic by Dr. Namrata Singh. And the moderator of the today webinar is Dr. Ruchi Mishra. Ma'am is professor at Ujjain College of Physiotherapy associated with RD Gardi Medical College Ujjain. She is having academic experience of more than 14 years and she is the IP Women's Health Coordinator at Ujjain. I just congratulate to that MP team, the Ujjain district, for organizing the webinar. And I just request all the delegates, please subscribe our IAP India YouTube channel to get in touch with the more webinars and like the Facebook page IAP India. Now, I just want to say thanks to the Dr. Sanjeev K. Jha, IAP President, and Dr. Ruchi Vasmay, IAP Women's National Head, for providing such a good platform for sharing the knowledge. I will just request now Dr. Ruchi Mishra, please continue.
Yeah. Hello. Good morning, all. Dr. Ruchi Mishra, coordinator of IAP Women's Cell Ujjain District. Welcome you all. As you know about the coronavirus or a COVID condition in the country, as well as the pandemic condition in the country. So it is very worst condition in the country nowadays. All the physiotherapists are in a trouble to how we start our setup with the new normal condition. So today we are discuss about the new normal condition for a physiotherapist, and our speaker is Dr. Namrata Singh. So the topic of Dr. Namrata Singh is PT practice during COVID pandemic and how to make it new normal. Now I'll discuss about the introduction of Dr. Namrata Singh is a physiotherapist and the lifestyle planner. She worked as a HOD in private hospital for 7 years, presenting running of physiotherapy as well as fitness clinic. She received award for appreciation in physiotherapy and fitness from Central Ministry of Health and Family Welfare on behalf of ISEC University. She won a blog writing competition award also. She conducts a lot of seminars and lectures in on the health in the school and the institution. And she had taken several seminars, lectures in corporate house also. She published several articles in newspapers, magazines, and the most amazing part is this: she is nominated for Woman of the Year award held by Nai Dunya Media House. So I welcome Dr. Namrata Singh to be a part of IAP Women's Cell, to be a part of IAP. As a Ujjain district, I welcome Dr. Namrata for taking the seminar.
Thank you so much.
Hello.
Ruchi. Am I audible, Dr. Ruchi?
Yeah, hello, Dr. Namrata.
Can you hear me?
Yeah, I hear you.
Okay, thank you so much for such a wonderful introduction, I must say. Should I start with the webinar? Do you want me to share my screen first, my presentation?
Yeah.
Okay, do I have the option of sharing screen with me?
You can share. You can share your screen. On that your screen in the center, the share screen is option is there.
Yeah.
And that you have to click.
Okay.
Then minimize the screen.
But I'm not finding. My desktop.
Just minimize the screen after like clicking the share screen. Minimize it. The Zoom screen you have to minimize.
Yeah.
Now you can go to the desktop.
Is this visible? Is my screen visible?
I'll just see.
Is my screen visible?
It will start, ma'am. Just wait. Have you started it? Share screen option.
Yeah, but is it visible? I think there is some problem. I am not able to
Not a
share my
problem. Just
screen.
try it, ma'am. You will be able to do. You have to just open up the Zoom again
Yeah, wait.
after clicking it.
I
Now
think
it's
it's
starting.
okay.
Now it's starting. It started now. Okay, it started now.
Yeah, but
It's
just tell me
okay.
one thing: how to make it full screen?
You have to go to the share slideshow.
Fine.
Slideshow view, ma'am. Then you'll click.
Slideshow.
Yeah, with a clipboard, you can see the slideshow is there. Yeah, now you can just click one by one.
Fine. So should I start now?
It will start. Sure.
I wish to thank IAP and IAP Women's Cell for inviting me to present the webinar. My very dear Dr. Ruchi Mishra, thank you so much for giving a wonderful introduction. Without wasting time, let's start. We all know that we are under a COVID pandemic situation, which is, it is a, you know, why I have chosen this topic first, let me tell you, because as everyone is utilizing time during the pandemic while sitting at home, I too have done many courses regarding physiotherapy, and I'm actually pursuing psychology also. I have undergone a course regarding COVID-19 awareness and management program also. So I thought of sharing some knowledge with you all. As we all know that this is a new normal nowadays, everything is new normal, and we will have to make it new normal because we don't have any other option, we don't have any other choice. We can't just sit at home and just waste our time. We will have to make many things new normal because, and with many precautions as well, we will have to do it. This is a global crisis, and everyone knows that the outbreak of COVID 19 has undeniably changed the standard methods of working for many employers and employees across the globe. This is across the globe. It is not just that India is facing this problem. This problem is across the globe, and we all know that. And I don't think I should go deep into the pathophysiology of COVID virus or something, because from past 3 4 months we all are like, very much into it ki, no one needs to know about what the COVID virus, how it enters to our respiratory stream, how the IgG antibodies develop in body. No, I don't think anyone is interested in knowing why it is named as coronavirus, because of its crown shape and all. So these are the basic things. I think we should skip this part. The main thing is ki, see during the global crisis, things are rapidly changing. Situation is changing rapidly, day by day, and even hour by hour. And many new researches are coming up every now and then, and many results are yet to come. We don't know what is going to happen. We don't know that jo bhi ho raha hai, it is all right or not. Many results are yet to come, and in all, everything is confusing. We can say we know many things about corona, or and on the other hand, we know nothing about corona. Situation is actually like this. So when the main thing is ki, it is leading to mandatory work from home. We don't have any other option. If we have to work, we will have to work from home, just sit at home and work. But work from home is not possible for every professional, and we are physiotherapists, and we lie under that category where work from home is not possible. Our job is not like patient is coming to you. We have many symptoms, we can even then prescribe them medicines. So no, patient remain with us for minimum of 45 minutes, minimum of 45 minutes. And I said patients, not patient. we are not just one patient वाली situation हमारे clinic पे नहीं होती है. We see many patients at a time. At our clinic we have a minimum of 4 to 5 patients that because we have so many clinics, so many patients at our clinic at us on a single time, you know. So and work from home for physiotherapist is also not possible because uh, we have power in our hands. We have power in our hands. We can't just listen to the patient problem and prescribe them medicine. हम वर्क फ्रॉम होम भी अगर करते हैं तो वी कांट हेल्प देम, मतलब see we can help only those who are facing some pain related, those who want to know about some exercises for frozen shoulder. They wish ki just teach us some exercises so that we can do. So the only thing we can do is we can just teach them some exercises while sitting at home through video call or through Skype or anything. But still uh, it is somewhere not satisfactory to us also, because we need to palpate the patient, we need to see their problem, we need to understand the problem they are facing, and then only we can prescribe them with manual therapy or equipment, whatever we want. So work from home, every time looking at the patient from video call is not feasible for us. We are physiotherapists and we can't do this, so we will have to make it new normal. हमें बाहर निकलना ही होगा, under many precautionary conditions हमें बाहर आना होगा. And see, as I told you, the corona chain is really unpredictable. You don't know from where the patient is coming. You don't know. You are meeting the people where the chain is connected. This is a huge, huge thing which no one can even understand, and researchers are still on for it. So this is unpredictable situation, and in this situation, nowadays, three most dangerous things are practicing, which normal people also doing. They are being negligent, they are being careless, and they are taking things for granted. See, you know what? Things are like, okay, you're my friend, you can come to meet me. You're my friend यार, चलता है, कोई नहीं, चलो let's meet up. अरे you are my colleague, okay, we can sit together. Do you know where your friend went to so many people? Do you know your colleague? You don't know, matlab, you are not living in the same house. Even people are taking it for granted, like they are, throwing dinner parties and lunch for their family members. Those are not living together with them. They are residing at different places, but it is okay. They are taking it like, okay, you are a family member. We are taking every precaution. Let us meet. Oh, it's my birthday, come on, let's join us for dinner and all. So the only difference people are doing nowadays is they are not going to restaurant for celebrations, they are celebrating it at home, which is another dangerous thing. In a compact place, they are gathering crowd, they are celebrating their birthdays, they are celebrating anniversaries and all. So this is actually negligence, total carelessness, and we should not, one should not take things for granted, because this is a unpredictable corona chain. No one knows about it actually. So see here, if I talk as a physiotherapist, we the new normal strategies we will have to strictly follow. We will have to impose new normal strategies on everyone around us, around to our employees, to ourselves, to our patients as well. We will have to create a safe and effective foundation for digital access. Digital access, because uh, the minimization of pen and paper things, we will have to do everything digitalized, so that patient can contact us in a digital way first, not physically. So we'll have to make a effective and safe foundation for that. Now we should impose, as I told you, we should impose proactively foster a safe working culture and mindset. We will have to develop this mindset because we will have to make it new normal. If we wish to be safe, if we wish to work safe, and if we want to make it a new normal, we will have to make it a mindset and a culture in everyone's mind that no, you will have to follow this, and we are going to do this only because this is the only thing. The strategies that you have planned should be followed by everyone. You should develop a shift culture for your employees also. Not so many employees at a time, not so many patients at a time. Shift culture for just one or two helping hands should be there. See, this is another positive point of lockdown, that many people are now self-dependent to work by themselves. They can do many work by themselves. So try to minimize your helping hands. First, try to do whatever you can do by yourself, then take helping hand, because we have so many patients with us, so we need someone to help there, to assess, to treat and all. So try for the minimization of helping hand and develop the shift culture at your clinic. It is for the safety of your employees also, and it is for safety of yourself and for your patients as well. All, everyone's safety, for everyone's safety. There are many challenges nowadays. If you will have to make things for a new normal, there are many challenges. It is unclear how long the crisis will last for. We really don't know for how long the crisis will last. This is chain is another again unpredictable, and we will have to use many challenges like what everyone is thinking nowadays, that when we were in lockdown, the everyone was scared a lot. When they are into minimum of exposure, they all were scared a lot, always scared a lot. And now, when in the phase of unlock, when they are in the market, and when chances of exposure is high, everyone is negligent and careless. Why? Because everyone is like कि okay तो चलता रहेगा, ये चलेगा, no doubt, but जो negligence start हो रहा है, that is not the thing that should be done. No one should feel negligent, no one should be careless, because so, you can be careless, but the corona is not careless at all. आप उसको ignore कर सकते हो, corona will not ignore you. Anytime anything can happen to all. So there are many challenges for us. Another challenge is safety measures and tools that we need in our clinic. It is again a challenge for us, because sanitization is a big challenge. uh, Sanitization, why it is a big challenge? Because a patient is coming to you, say for example 20 patients are there in a day with you. You will have to sanitize many things for 20 times. It is not just the chair on which patient was sitting. No, it is the chair, it is the couch. You need 20 disposable sheets, you need disposable pillow covers for them. You need to sanitize every equipment used on the patient. You need to sanitize all the tools that patient has touched. We have many exercise tools like shoulder pulleys, wheels, and balls, and we have many other exercise equipment with us which a patient can touch several times. So for example, if a single patient touches almost around say for 10 things, and you are having 20 patients, so just imagine for how much of the time you need to sanitize these things after every single use. This is really a big challenge for all of us, and this is the new normal. We will have to make it new normal because we don't have any other option. But see, by the time we will get into this, we will definitely know how to change the things, how to do more sanitization, or how to impose many other sanitization things and all. But see, this is really a big challenge, and this is a headache kind of thing also, that we will have to sanitize so many things after every single use. Another challenge is we need many safety measures at our clinic, many other tools like We need cap, we need disposable gown, we need mask, we need face shield, shoe covers, we need gloves, everything. And again, we need UV thermometers and pulse oximeter and all in our clinic also. So this is a kind of, मतलब ये एक हमारा खर्चा भी बढ़ गया है definitely. And patients को भी ये समझाना is really difficult that we all need this. और see, I don't know, but I'm sure many of you have experienced this, कि people are little where the money is involved for their health, where money is involved, they are little careless. They are like कि okay, it's okay. अगर हम उन्हें बताएंगे कि भाई we need it for you also, you will have to take this gown from us, or if we put an additional charge for them, it is not easily digestible for them where their health is concerned. But on the other hand, at the same time, they can go to a salon and they can spend a lot of money on kit and all. They will take selfie from a salon, and they'll post it as a new normal. But where health is concerned, they will not post it as a new normal. They will be like कि अरे यार एक्स्ट्रा बहुत पैसा लगा दिया, बहुत फीस बढ़ा दी. So this is a normal mentality of people, and I'm sure everyone is facing this issue. और ये हमको face करना ही है, and we will uh, if we all work together for this, if we all join up and work together with the same points, with same points to impose on the patient mind also, then we will overcome, definitely we will overcome from all these things. See, where in this pandemic, we will have to face many challenges. We will have to deal with many disadvantages also, because at first, what, many patients and physios will find isolating, for sure isolating at first, because in our clinic, we have a habit of looking many patients at a time. And we will some patients are on couch, on equipment, some are doing exercises, some are being treated by physiotherapists. So it is a kind of social culture in our clinic. And patients are all together, they are talking to each other also, they become friends with each other on our clinic after coming to our clinic also. And it is kind of social atmosphere, and I always feel this is the beauty of our profession, that our department is so socialized and so energetic and lightened up by patients. Many a times I found it so amusing that many females are, they become friends very easily. They are uh, uh, exchanging some recipes, they are exchanging many tips with each other. So this is a kind of isolation kind of feeling आ सकती है patients में, because we will have to make them in a separate we will have to treat them in a separate compartments. हम उनको socialize नहीं कर सकते, हम उनको एक साथ एक hall में लेकर नहीं आ सकते. So we will have to deal with it, and by the time, uh, as the time will pass, everything will be all right, this is for sure. Because everyone wants their safety also, we also want their safety and their good health. We will have to make everyone comfortable, because and things are now from past 3-4 months, everyone is so much aware that this is not much difficult for us or any physiotherapist to make them comfortable regarding the present scenario. They all know that why it is going to happen, why this is necessary for them. So we will have to make them more comfortable on presenting some of our points or some of our thoughts to them. You will have to provide support and comfort to everyone. You will have to provide training to your employees as well, because most of the time when you are not with patient, when you are handling, yeah, assessing another patient, if treatment is given by your employee, it is the employee who is dealing with the patient. So you will have to give employee a proper training also on how to speak in front of patient, why these all things are necessary. They have to make them aware on everything so smoothly should be done, कि patient को समझ में आना चाहिए कि yes, this is necessary for us. So provide training to your uh, employees also. This deal with some disadvantages, and we will become habitual for all this. I'm sure we all can do this. So another new normal thing is workplace hygiene. Workplace hygiene is the same thing that I told you. We need to do so many sanitization. Clean and hygienic workplace is the first new normal hygiene, workplace hygiene. Why? Because we need hygienic surface, we need clean and hygienic objects and equipments. Why? Because we don't want to put ourselves and to put our patients or our employees on any kind of risk. So our surface like floor, chair where they're sitting, they should be clean, thoroughly clean. Our objects like pen or whatever things we are using, our tables and some that should be clean thoroughly. Our equipment should be sanitized properly, and this should be done after every patient. After every patient we should do this. Another thing is regular hand wash. Everyone knows about the regular hand wash. It is really important for us also, for employees and for patients. We should make it mandatory that before entering our clinic you will have to wash your hands, you will have to use sanitizer in between the treatment process. Go and wash your hands, ask your patients to go and wash their hands. It is, make it mandatory that regular hand wash should be done. Hand wash not in a way just कि बस फटाफट फटाफट गए hand wash कराए ना गए. अभी तो now nowadays every children also know that we should hand wash for 20 seconds. Everyone knows that. And the simpler way is कि it is not that कि हम hand wash कर रहे हैं and we are counting on 1 second, 2 second, 3 second. This is not done. So what you will have to do, because you are in a hurry, you want to assess your patient, you are in a hurry because so many patients are waiting for you, so you will not count it. But on the other hand, if I say just sing a song, just sing a happy birthday song for 2 times and wash your hands. See, उसमें you will see 20 seconds आराम से निकल गए, and you are singing, you are at least for 20 seconds you are at peace of mind also. Just sing happy birthday to you, full song for 2 times, and wash your hands. So this is the simplest thing which you can teach to everyone, to your kids also. They will also enjoy doing this. Another new normal is respiratory hygiene. Yes, it is most important thing. Another important thing, you will have to ensure the availability of face masks and tissues at your clinic, because we all know that respiratory hygiene is very much important. It is it should be made mandatory for everyone, for patients also, for yourself also, and for your employees also. Education should be given on coughing and sneezing also. Many people are still not aware of how to cough and sneeze in public. So we will have just for a single time, or just make a chart and paste it at your clinic wall that how to cough and sneeze. They are using mask. If cough and sneeze is there, they will have to switch off their mask. They उनको हटाना ही पड़ेगा mask को, and ask them to cough or sneeze at the bend of their elbow, or take a tissue for and discard it hygienically in a closed bin. So these are the many small things that are enough to keep your respiratory hygiene. And another thing is breathing exercises. Yes, breathing exercises is very important. And what I have seen that after every time, after every 1 hour, 2 hour, if you perform some breathing exercises along with your patients also, that is the good practice to because all the time you are wearing a mask. Because of mask, many people are facing some respiratory issues also nowadays. So make it a habit, make it a new normal of doing breathing exercises, just normal breathing exercises. Just breathe in and breathe out through mouth. Just make it a new normal thing for everyone. Like patients are there at your clinic, after 2 hours alarm will bang, and you will be there standing and asking everyone to do breathing exercises for 5 seconds, 10 seconds, 20 seconds. It's enough. 20 seconds you will do it many times. So make it a new normal thing for your respiratory system also, and it is really important thing. Every physiotherapist should work on self immunity also. See, it is said that work on your health first, then you will be able to keep others healthy also. So for working on your health, you will have to take some measures for boosting your immunity. For that, you can boost your immunity through diet. Definitely through diet we can boost. See, you know what, वो ज़माना वापस आ गया है जब नानी दादी माँ के जो नुस्खे हुआ करते थे वो सब फॉलो करते थे, एंड नाउ इट इज़ द सेम एरा, you know, everyone is believing those दादी माँ and नानी माँ's नुस्खे. Everyone is trying that. Okay, not going so far, let me take my example, my personal view. I am I was not well from past like 7 days. I was having cold and cough, and believe me, I was scared like anything. Believe me, abhi jo recovery hai, I am feeling like I am recovered, not from cold and cough, because I have done so many things ki matlab everything, I have done everything like as if I have catched coronavirus and I will have to get rid of it. I know that was a normal cold and cough, but still the thing is हमें डरना पड़ेगा, वही एक बेस्ट चीज़ है. So through diet, I really want to share some good dietary habits with you all, that you all can follow, and घर पे भी सबके साथ आप ये follow कर सकते हैं, and it is very easy to boost immunity. Everyone nowadays, you know, is like they are working on they are drinking giloy wala pani, giloy water. They are they are using basil leaves in everything. So two or three things I really want to tell you, that do this thing, and this is really मतलब ये मैं बचपन से शायद देख रही हूँ, मेरी नानी माँ ये करती थी. ड्यूरिंग द चेंज ऑफ एवरी सीजन, during the change of every season, what she used to do, she used to put some basil leaves in the our drinking water, the pot of drinking water. She put basil leaves in that. Now the new normal thing is put basil leaves along with a giloy leaf. A giloy leaf or two leaves of giloy is enough to put in water. So this really works. If you feel कि आप अगर आप सोचोगे कि आप घर में बच्चों को बोलो कि चलो काढ़ा पियो, they will not at all. मतलब यंग जनरेशन, जंक वाली जनरेशन काढ़ा तो कभी नहीं पिएगी. तो अभी इवन आप घर से निकल रहे हो एंड यू वांट टू ड्रिंक समथिंग, और आप ये सोचो कि मैं काढ़ा पी के निकलूँ, तो ये मुझे नहीं लगता कि इतना न्यू नॉर्मल हो पाएगी ये चीज़ कि लोग चाय की वजह सीधे काढ़े पे ही आ जाएंगे. मतलब फॉर आवर जनरेशन आई डोंट थिंक इट इज़ दैट easy to do. So do this thing. Tulsi and giloy ki leaf ko just put it in the water, in your drinking water, pot of your drinking water, and use that thing, right? Another thing what we are also doing is we all are used to drink tea. अगर हम ग्रीन टी ले रहे हैं और वी आर टेकिंग मिल्क वाला टी, टी लीव्स होते हैं हमारे पास. व्हाट वी कैन डू, इन टी लीव्स हम बहुत सारी चीज़ों को मिक्स करके इन टी लीव्स ही हम उसको मिला के रख सकते हैं, सो दैट अगर बच्चे भी वो चीज़ ले रहे हैं, लाइक वी कैन ऐड सिनेमन इन दैट. We can add some ayurvedic preparations like arjun ki chhal and all. It is, and it really, it is worth it, you know. Some black pepper powder add in the tea leaves itself, and you don't have to put extra efforts for that also. So work on boosting your immunity, and few things are you know, it is lost from our days, that many people are not taking nuts regularly, dry fruits regularly. They are not having fruits regularly. So what you will have to put in your daily diet, matlab, make it a compulsion that you will have to take dry fruits daily. Either fix one time, or either early in the morning or in the evening, wherever it is comfortable for you. I think early morning dry fruit taking is easy for everyone. On an empty stomach, have a cup full of green tea, the most refreshing thing. And another thing, take some almonds, walnuts, just हो गया nuts का काम भी, and it is all done. Another thing that you can improve your immunity is through exercises. Definitely, yes, exercises. So daily routine, it should be our daily routine to do exercises. I'm doing exercises since years now. So it is like, make it a habit, like you are मतलब खाना भी हम खा रहे हैं ना, it is a habit, हमें खाना खाना ही है. The same way, put this compulsion to yourself, exercise is the food for you. To do some exercise for yourself, just take some 20 minutes or 25 minutes of timing. It is not that difficult. हम कितना भी busy हो, हम हमारे लिए अगर 30 minutes भी निकाल रहे हैं तो we can do that. So boost your immunity, your self immunity, do some exercises, eat, take proper nutrition, do some meditation for your peace of mind. Because see, things are so jumbled up nowadays, and we have many challenges, we have many things to handle every day. So many challenges are there. So for all, to handle all those things, your mind should be settled, your mind should be at peace. So for that, you need meditation also. So do it for yourself, not for anyone. Don't do it for everyone, just for yourself. Spend a me time of at least 30 minutes per day. It should be a me time exclusively, no one with you, only you and your exercise, your meditation, your music, your book, whatever you want to do. Just spend some time with yourself. So practice some new normal safety measures also, like we all know that we will have to do some so distancing arrangements in the waiting area of our clinic for patients. And everyone knows that we will have to provide safety kits to patients. And another thing, follow strict timings. uh, हमारे क्लिनिक में कई बार इट हैपेंस कि हम जो पेशेंट को टाइम देते हैं वो उसको फॉलो नहीं करते हैं, दे बिकॉज दे नो दैट कि ठीक है वो तो चलता रहेगा, हम जाएंगे, हम कर लेंगे. बट नाउ यू विल हैव टू फॉलो स्ट्रिक्ट टाइमिंग्स. जिस पेशेंट को जो टाइम दिया है उसको उस पर आना पड़ेगा, अदरवाइज दे विल मिस देयर सेशन फॉर another hour or 2 hour or whenever you have time slot. So follow the strict timings, because this is good for you also, because you can't change your PPE kit for every patient. Or just go for a smooth routine. Don't break your routine in between, like 9 to 7 किया, 9 to सॉरी 9 to 2 आपने सुबह वर्क कर लिया, फिर आप इवनिंग वर्क कर रहे हो. आई थिंक थोड़ा सा इसमें चेंजेस लाने पड़ेंगे, क्योंकि डू इट एट अ स्ट्रेच एंड फ्री. पेशेंट्स को भी फ्री करो, आप भी फ्री हो जाओ. And we have compartments at our clinic. Many physiotherapists have the aluminum partitions. Some have curtain partitions. If any one of you have curtain partitions, then I will suggest we should make 2-layer curtain, minimum of 2-layer curtain partitions. How? One should be plastic curtain and another should be a cotton layer of curtain. This is important for it is a kind of filter only, like we are using 3-layer mask. It is the same at our clinic. Patients are at different distances. Put a 2-layer curtain between every patient's couch. So this is the new normal practice which we will have to follow. And another new normal social hygiene should be, we should practice the ways to say hello without touching, without giving a hug, without patting on shoulders, without touching, without handshakes. Just the best way is to say namaste. Our Indian culture is namaste, and namaste. Thank you to all. Here I rest my presentation. I'm done with my presentation. Dr. Ruchi?
Hello. Any questions? Participants want to ask any questions to ma'am regarding this presentation? Hello. Is Dr. Vinod Kaushik live? Hello. Yeah. Any participants wants to ask any questions? Hello.
Hello.
I hope we are visible and audible to everyone. Huh?
Hello.
Yeah.
Yes, ma'am.
Nobody wants
Tell
to
me.
ask any questions. They all are very much satisfied with your presentation, and this was really amazing presentation. I hope the participant enjoy a lot and they learn something good from your
Thanks a lot. Thanks
presentation.
a lot. Thank you,
Yeah.
Dr. Ruchi, Mr. Ma'am, Dr. Namrata ji. Thanks for a wonderful session, because the clinician need this thing at a very high level. how they have to
Yeah.
practice.
Yes.
I would
Thank you
also
very
like
much.
to thank to our respected President Dr. Sanjeev Jha sir, Dr. Ruchi Vashne ma'am, K. Manna Malai sir, as well as our journal head Dr. Sakina, Dr. Pinky, my entire IAPWC team. Thanks to all for presenting such a wonderful presentation, as well as Dr. Namrata, Dr. Vinod Kaushik, and his team. Thanks.
And
Thanks a lot.
ditto from my
Thank
side
you.
too. I thank to everyone. I thank to everyone, and I hope you
Uh,
will get to know something, just learn something. Matlab, there can be two things: either you have learned something, or you just namaste. Okay, it's done.
no, we have learned very nice things with you, ma'am. Thank you very much.
Thank you
Thanks to
so much.
all the delegates on the
Thank you.
behalf of IIP India technical team. Again, I request everyone to subscribe IIP India YouTube channel and IIP India Facebook page so that you will be updated with the latest webinars. Thank you very much. Thanks a lot.
Okay. Thank you. Bye bye.
Thank you everyone for joining, for coming, for listening to me.